Hi there, my name is Nancy Raymer and I'm an occupational therapy assistant student. And today we're going to be going over what's called PROM, which is passive range of motion. And I'm going to do some shoulder PROM exercises with Ed to show him or to show you or to show that I can do passive range of motion for the shoulder. But first I wanted to tell you a little bit about passive range of motion. Basically it's an arc of movement where an outside force will do the movement for you, as opposed to active range of motion. And some of the reasons that we would do passive range of motion on our clients is because, like I said before, their inability to do the motions themselves, and we would be the outside force that would do the movements for them. And that is in order to decrease their stiffness, their swelling, and their pain involved in the inability to move their joints, and it's also to increase circulation. It's also a point to be made is that it's not going to bring back or recover any of their movements, but that we're going to maintain the movements that they have. It also helps them visualize the movements a little bit. So there's some things to remember when we're doing passive range of movement with our clients. One of those is to use soft hands, to always remember that we're placing our hands on people. So on that note, I'm going to be placing my hands on you in different areas in order to perform the exercises. And to, use warm hands if you can. So I'm going to stand up and stand aside from Ed in order to perform the passive range of motion. So like I said, we're going to do approximately 12 different motions for shoulder PROM. Okay, and the other thing before I start, I'm going to tell you to let me know if I cause any pain, because passive range of motion is not supposed to cause pain. Okay, so will you let me know that?
Yes.
All right. Do you have any questions before we start?
I have no questions.
Okay. So the first thing that we want to do is make sure that our body mechanics are in correct position as well when we're doing these ranges of motion with the patient. In order to do that, we might have to crouch down, which I'm going to do. I'm going to place my arm underneath his arm. I'm going to have him sitting in anatomical position. But first and foremost, I'm going to place my arm under his, my elbow under his, and my hand under his wrist in order to stabilize the distal and proximal joints, because we're just going to be working the shoulder. So one of the first movements that we're going to do is we're going to start with his arm at his side, and we're going to bring his arm up, and that's called flexion. So that's shoulder flexion, and this is shoulder extension. We're going to do the motion slowly. Shoulder flexion, shoulder extension. All at the same time, we're going to be facing the patient and seeing if there's any kind of looks on their face as if they're in pain, and ask them to move the arm if they can so that they can participate. Okay, so move it if you can, but a lot of times their arms will be flaccid and unable to be moved themselves. Another movement we're going to do is called abduction. We're going to bring the arm up to the side while stabilizing all the others. This is called abduction, and bring the arm down for adduction. Once again, it's abduction and adduction. And one thing that I forgot with the extension and flexion is to bring the arm back. So one more thing that I was going to do here, holding the arm steady. Another motion that we're going to do is horizontal abduction and adduction. We're going to bring the arm up and bring the arm in for horizontal adduction and outward for horizontal abduction. Horizontal adduction and horizontal abduction. Now we're going to bring the arm down, put the elbow slightly up, and I'm going to stabilize his arm, and we're going to do internal and external rotation. So we're going to bring the arm in for internal rotation and bring the arm out for external rotation. Stabilizing the elbow and the wrist so that it's only the arm that's moving in, the shoulder for internal rotation and external rotation. Now we're going to bring the arm down to the side, and we're going to do something called shoulder elevation and shoulder depression. We want to be careful for subjects or clients that have hemiplegia and avoid this movement because of subluxation. But in order to demonstrate today, I'm just going to show you elevation and depression. So we're going to stabilize the arm and shoulder, and we're going to press up for elevation and push slightly downward for depression. Once again, slowly upward for elevation and depression of the shoulder. And then finally, we're going to do protraction and retraction, where we're going to put the arm straight out, And we're going to push slightly forward for protraction, and then backwards for retraction. It's kind of hard to see in the video, but we're pushing forward slightly on the shoulder joint for protraction, and then retraction. Do you have any questions, or did you feel any pain?
No pain.
All right, great. Well, I want to thank you today for viewing the video, and thank you for participating with me. And that's it. Talk to you next time.